Okay. I tried to interview these gentlemen who are for the public option. They don't want to say anything. Are you surprised by that?
Not at all. Are you kidding me?
Okay.
The back of his sign says Glenn Beck sucks. He's really a college grad, isn't he?
Right.
Can think of nothing else to say.
Are you paid to be here?
Absolutely not.
No,
I've been attending these since April 15th on my own volition.
Oh, were you bussed in from anywhere?
No, sir. I drove myself. I drive myself to every one of these.
Are you from Long Island?
Yes, I am.
Okay, very good. What about you, ma'am? Anybody paying you to be here?
Absolutely not.
Let me get your sign.
No one's paying me to be here now. I give up my free time. I left my job half a day just so I could be here to voice my opinion. So
you're losing money rather than being paid money, really, to be at these rallies, then?
Absolutely.
Okay.
It's definitely time well spent.
Okay, thank you very much.
Thank you.
Propaganda! Propaganda!
Yes, sir. Why do you say that? Why do you say it's propaganda what these people believe?
I say what you believe is propaganda.
Who? Like what? What is propaganda? Can you explain it?
To you, no.
No, to anybody, to the American people. It's going to go on YouTube for the nation.
I got nothing to say to you.
You don't want to say it to the American people? It's going to go on YouTube.
I got nothing to say to you. You don't have my consent, so you shouldn't be videotaping me.
Oh, okay. So you have nothing to say to the American people?
Nothing to you.
I'm not asking you to say
anything.
He doesn't make your consent. Sir, what are you so angry about? You sound like an angry mob.
Yeah, you do. I sound like an angry mob?
Yeah.
Actually, you sound like an asshole.
Yeah, what mob do you belong to?
You're the asshole.
Yeah?
Yeah.
Is that right?
Is that right?
Why a name?
You calling me an asshole, so I'm calling you an asshole.
Okay.
Yeah.
Yeah?
Yes.
There's a group over there who's claiming to be for the public option and for the Obamacare, but they don't want to talk about the reasons why. Does that surprise you?
No, it doesn't. Simply because their union bosses had a hand in writing the bill. They have an undue influence on our congressmen, and they have a stake. They have skin in the game, so to speak. The various bills that are on the table right now, in essence, are unconstitutional. There is no foundation in the Constitution for the government setting up or taking over health care. The specific powers that are granted to the federal government are very limited, and health care is not one of them. Before anybody who is debating the issue gets into whether or not they want a public option, whether or not they want single-payer health care in this country, is not an issue. They should first examine the constitutionality of the issue. It's not a matter of what this group wants or that group wants. It's simply a matter of constitutionality.
Thank you very much. Okay, there's a speech going on by one of the local union members there. UAW local. I'm assuming he's talking for Obamacare. Okay, it looks like these are their members. They're accusing the Tea Party goers of orchestrated rallies, but this looks pretty orchestrated because they're all members of the union. They're wearing their union shirts. So if anybody's being paid, it's probably them.
CWA, Chris Shelton.
Thank you, John. Good afternoon, sisters and brothers. You know, it's great to see this crowd here today, but labor is always in the right place at the right time, and this certainly is the right place at the right time. We're here today to make sure that the folks that we elected Congress understand that those people across the street don't know what the hell they're talking about. That's not true!
So are you willing to make any comments about your position about universal health care? No?
Like I said, there are 49 million people that are hurting. And
Speak a little louder, sir.
There are 49 million people in this country that are hurting that don't have health care. I have terrific health care. Terrific. But I'm not doing this for myself. I'm doing it for 49 million other people that are hurting. Those people die earlier. They get sick in intense ways. I don't even want to think about it. It's beyond. Why did we can't come up with a system that helps these 49 million Americans out is beyond me. The richest country in the world can't do. We pay twice as much per capita than the French and the Germans. They have total health care and they're longer than we do. Why can't we imitate something that is good? Why do we have to perpetuate a system that is so harmful? It's expensive and harmful. I just don't understand it. I don't get it. I'm sorry.
Okay, well, some of the people who are opposed to this bill feel that there's ways of fixing it without complete overhaul.
Tell them to come up with it. Tell them to come up with it.
Okay, well, that's what the debate is about.
I want to see them come up with it.
Right.
I want to see them come up with it. I want to see them present it to their congressman.
Right.
I want to see them. They'd be wonderful. But right now, let me tell you.
Okay.
Here's what they're coming across as. They're coming across as the health care that their health care program is titled "Get Sick and Die." That's what it looks like to me. You don't have health care, too bad. Get sick and die. That's what it looks like to me, and personally, that's the way they come off. They come off as uncaring, unfeeling. But they ask me, why are you doing this if you're so well protected? Well, you know, I was for civil rights legislation back in the 60s. I had nobody in my family lynched. I had nobody in my family had to go back to the bus. I was for it because there were millions of people that needed that kind of protection. Really, if you got it, help somebody that doesn't have it. That's my philosophy.
Okay, so you don't feel Medicare and Medicaid already is not helping people who can't afford it?
Medicare is wonderful, believe me.
Okay.
I'm on Medicare now myself. It's wonderful.
And do you know about 9 million people qualify for Medicare who are not on it now as part of that 47 million
And they
people?
should probably, so I'm down to 40 million.
Okay.
Wean me down further?
Well, I'm part of that 40 million are people who are illegal immigrants.
Okay, fine. We'll work out the illegal immigrant in a different way. I'm talking about the tens of millions, 40 million you want to call it? Want to argue over 9 million? Fine. Just do it. Just get the job done and we'll help those people out.
Right, but it requires a rigorous debate. It requires a rigorous debate.
This is more than a debate. This is something else. You see, I believe underneath it all that you have in this group that's against it is not against it if somebody else on their political side came up with it. They don't like the guy that's leading the pack. I hear people saying on television, I want my America back. What the hell does that mean? What does that mean?
It means they don't want bills that are rushed through.
No, wait. I want America back. Doesn't have to do with a little bill.
Bills are formed with deliberation.
Why do they want that? What does it mean? I want my country back.
They want their congressmen to represent them and not spend their money indiscriminately.
That's not America.
That's not America. Spending money indiscriminately is America.
It's something beyond just spending money, and I don't like what I think is underneath it.
Well, Congress already spent $1 trillion in a stimulus bill. Now they want to spend another $2 trillion on health care. Where's the money going to come from? That's what they're saying.
Well,
how is that un-American to ask that question?
That's perfectly legitimate to ask. Perfectly legitimate to ask.
Okay.
I'm not against
That's what they're saying.
No, it's not what they're saying.
Yeah, because they feel they're being rushed. It's already passed the House. All it's got to do is go through the Senate, and then
they'll modify it, and they'll do the negotiation thing. Something will come out of it, hopefully better than what we have. Right now, what we have, we're 37 in the world in healthcare.
Why do people from other countries come here for?
They don't. No, you're wrong. You're wrong. You're wrong. People are going to India now to get their operations. India, because it's cheaper and just as good. Come on, that's a big phony thing. It's a big phony. People come here. People go there. It depends on where they get the best deal, and it depends on what specialists they're looking for. You go to Sweden for some kind of operations. They come here for other kind of operations.
85% of Americans seem to be happy with their health care plan.
I'm happy with mine too. I'm happy.